Hmm. Well, sometimes the child might not tell the parents
Mm.
about them not being able to see or any sort of issue with their eyes. So as a parent, we need to sort of look out for any signs, any anything that might raise any sort of vision questions. So things like if they squinting when they
Mm.
looking at the iPad or watching the TV, or they tend to come and sit very close to the TV, or if they rub their eyes a lot, because sometimes
Mm.
when a child can't see well, the natural tendency is just to try and rub their eye and try and see better.
Mm.
Or even things like they avoid sort of reading uh, because it's so uncomfortable trying to focus on the words on the page because they might have um, a high prescription that is not corrected.
Mm.
Or sometimes parents can actually look at their child and see that their eyes are not straight. One eye is looking straight, the other one is looking inward or outward. So
Mm. Mm.
that's a squint.
Mm.
So those are the things. But usually, before they start, 4-year old kinder or prep, we would like to see them. Um, we get a lot of referrals from school nurses. The nurses go to the school and do sort of a screening vision test, and if they
Yeah.
notice any reduced vision or any issues, then they will give the parent a referral to take the child to come to us for a thorough full eye examination.
Mm.
Um, and that usually happens in prep,
Mm.
um, or yeah, sometimes we see children at 4 years of age with a referral. So that means they're still in sort of kindergarten.
Mm.
Yeah,
Mm. Well, I know, you see a lot of children there in your practices.
sure.
Um,
Yes.
I had an eye test myself a few weeks ago, and it's the standard thing where you got to read the letters from the bottom line as best you can. But like in the case of a lot of very young kids, like maybe they don't know their alphabets
That's
so
right.
well yet. So
Yeah, a lot
so
of
I
that. Yes.
I imagine that the eye tests for kids are in many ways different to eye tests for adults. So can you tell us a little bit more about that?
Yes, sure. So we always try letters and numbers first, and usually we find that they know numbers from 1 to 10. Um, but if they can't, read letters or numbers, then we have pictures that we can show them, and we have a method which we show them a letter, and they don't have to know the letter; they just have to look at it and try to point to a matching letter on a book in front of them. So that works quite well. That works quite well. So assessing their vision um, is the most important thing that we do. Assessing their eye movement, so their ocular excursions, their sort of prescription. Now, it's a bit of a challenge to measure a prescription in a trial. So we have special methods where they don't need to tell them or tell us anything. We don't need to ask any questions. We just need to put a special drop in their eyes, and we use that method to measure their prescription. We also check for any squint, um, any allergy. Um, a lot of young kids in Australia have allergy, and that often
Mm.
involve ocular allergy. So yeah, I must admit it's more challenging testing uh,
Mm.
a kid compared to an adult for obvious reasons. Yeah,
Mm.
but we see a lot of kids in our two clinics in St Albans and Footscray. Yeah.